Hi everyone, I'm Susan Birch and welcome to this month's Q&A. We've got Dr. Juliana Nahas with us today, and she is a specialist paediatrician in ADHD and autism. And thank you so much for coming and sharing your wealth of experience with us.
My pleasure, Susan. I'm glad to be here.
So I'd like to just kick off, if you just want to talk a little, just for a couple of minutes, about your background and your experience with these conditions, and then we'll get into the questions from everybody.
Your audience may have seen me on another podcast we did, and I'm a functional pediatrician now, but I started off as a general pediatrician in the US about 30 years ago. When I got sick about 15 years ago, I went to conventional doctors. They couldn't explain what was wrong with me. They told me everything was fine. All the labs are fine. You don't have a diagnosis. You just have symptoms. So go home, take some Advil and rest. And that just didn't sit well with me because I've been already doing that for many months and I wanted a different answer. So I started listening to podcasts and telesummits and things like that and got myself into this arena where I was hearing this term functional medicine come up quite a bit. I've never heard of it. Let me research it. And the more I researched, the more light I saw and the more like I thought this was brilliant. And how come we don't learn that in medical school? And basically functional medicine looks at how does the body work. It borrows a lot of information from naturopathy. If you're familiar with naturopath science, it looks at the basic underpinnings of the cells and how the physiology of the cells works. So they're not looking at diagnosis, but they're looking at if you have fatigue, for example, that's a symptom. Well, let's see what causes fatigue. What are the underlying malfunctions of the cell that leads to fatigue? And they do specific testing, so they don't guess, but they tend to run specific batteries of tests that will reveal the health of the mitochondria, which are the motors of the cells. They're the powerhouse of every cell. And each cell in our body, we have trillions of cells, as you know, but each cell has trillions of mitochondria. So it's very complicated, but these cells actually run our metabolism. And if things go wrong, like they have too much stress on them, then our metabolism starts to slow down or starts to have problems. So that's how I managed to get myself better. I did work with a doctor and a nutritionist at the time. And within 3 months, I was like back to myself. It was amazing. So having seen the light and having a lot of parents ask me, you know, our children have this disease and that disorder. What can we do for them? That's natural. We don't want to give them medicine. What can we do that's natural? So the wheels started turning in my head and it's like, I got to put the two together. What I'm learning from my own health and functional medicine, and now how can I bring it to pediatrics? Because there wasn't a lot of topics on pediatrics.
Would you talk a little bit about the program you have? Is that just available to practitioners, or is that something that parents can access online?
On my website, I have a free mini course. So you can access the free mini course. Anybody can access that. To work with me virtually, I think, you know, countries outside of the US, I wouldn't be able to see the patient in person. So it all would be remote testing and that sort of thing. So that's where I would just do functional medicine. I wouldn't do conventional medicine. I wouldn't be prescribing medication, but we can do the functional tests like the organic urine test or the stool testing.
I can get access to those tests for people
Yeah.
through New Zealand, and then they can have you review the tests.
Right.
And make
So I can partner with you, Susan, and we can really help them.
Because you have to have a functional medicine practitioner in New Zealand to be able to get access to the testing. And so we do have a couple of companies here that provide them, but they have to have a within New Zealand practitioner.
Yeah.
But we could work together. I could certainly get the tests and organized, and then you can do the interpretations.
Yeah.
And
I can weigh in on that. So I can be your consultant basically, but we would co-manage the patient. Yeah. So definitely we can do it that way. There's not many pediatricians that are double boarded like I am. I think there'll be more in the coming years, but it's really just burgeoning. Functional medicine caught on much bigger for adult medicine, not so much for pediatrics, but I think there's a need now and hopefully more people will get on board.
And lots of thank you very much. Such an informative session.
My pleasure.
It's been Absolute pleasure to have you here.
Thank you.
And I'll just point to everybody to the interview that you and I did together just before Christmas. You shared a whole lot of more information there, and I'll make sure that we share how people can get in touch with you. Are you happy for me to share your email address, or do you want them to go through your website?
I think the website is easiest. Here, let me type it in. It's covingtonpediatrics.com. And on the site, you'll see a lot of banners and things that you can go watch the video, you can watch the webinar, you can apply for a session to talk with me. Like there's different uses on the website.
Telemedicine is just so wonderful. You know, we can connect people all around the world and find this is such a specialized area. And I'm just so delighted to have found you to be able to send people your way and have you help.
Now, I'll mention this. I'm going to team up with my mentor, Dr. James Greenblatt, starting in May. I think he's setting up a whole virtual clinic that's going to be nationwide. So I'll be able to see patients through that clinic. I don't have the details yet, but that's coming. That's in the works. So that will allow me to also reach out to more people who maybe don't know that there's another way and give access to something that may be hard to drive to see me. You know, we can do it virtually now.
I'd like to keep in touch with you about that myself, because then that gives me another tool in the toolbox to be able to send people in the right direction, and I can certainly help get the word out in New Zealand that you're available. Thank you so much.
Thank you, Susan. Have a wonderful day.